So I was asked to come today to explain my concerns regarding the lack of space here at the Islesboro Health Center. For the number of people that are usually here on a daily basis, we figure it's about 10 people. It's too small. It's very difficult for me, I'll speak about myself, to get work done, as there's a lot of noise, phones are ringing, people are talking, which they have to do the job. Many times I'll go into the pharmacy. Sometimes I've gone into the bathroom or into an exam room that's not occupied to get my dictations done. And many times I wait and do it at nighttime because I need to sit and think about some of the cases before I dictate. I think it adds a layer of stress to all of us, as we're already stressed out from COVID, but to be overcrowded adds more stress every day to our job, and it just makes it harder to do and is wearing on us. Did you want me to address?
Talk about the room, maybe. This is
Okay, so this is our office, and Owen has done a panoramic of the office. And what makes it hard about sharing an office, which I have done before in other locations, is when you dictate, you really want to concentrate on what you're doing. It's a legal document. It's hard to dictate. It's hard to talk to patients on the phone when you're sharing an office with somebody else. And I've always had that problem, as other providers have that I worked with. The space is small. We many times have extra equipment in here for patients. We do on the floor. We have extra bags that we take on house calls, taking the ambulance with us, and any overflow of equipment. So we sometimes have in here also. So we're going to enter the pharmacy here. Which is the powerhouse of the office. There's a lot here that we use, but it's a very small space, and we have a lot of stuff in here besides medications. And we have equipment that we loan out to patients. We have crutches. The rest of the crutches are upstairs in the attic, which makes it harder to access them. We have a lot of cleaning products in here, a lot of products for us, for our hands, for sanitizers, gloves, batteries. And of course we have, do you want me to mention?
no, don't mention that.
And it's pretty crowded. I mean, we have things arranged in here, but it's still pretty crowded.
Basically, top to bottom.
Yeah, and sometimes it's hard to find things in here, especially on these shelves, because sometimes stuff gets moved around, it gets in behind, we don't know that we have it, we reorder it, we've already got it.
Sweet.
Anything else?
No, that looks
you can
great.
think of?
Doing
Okay,
great. Now we'll go to the lab.
Sure. Oops, let me shut the door here.
You want me to talk about the lab, or you want to do
I
it?
can do it. This is a unique setup, and it's approved by the state. So we have a kitchen and a lab together, but you have to have very definitive lines of where the lab starts. So you see this orange tape here. So from this orange tape around is the lab area, and that refrigerator is the refrigerator for medications. We cannot store food in that. We have a dirty work area, so if you have urines or stool or anything like that, you don't want them in the clean work area, which is up here. But it's very small, as you can see. We have a microscope here, which we use a lot, especially for ticks. We also do blood collection here every Tuesday morning. So we have all the equipment for blood collection. Many of the blood samples have to be spun down before we send them over to Penn Bay Medical Center. Then we have a lot of our tubes we use for blood collection, needles, and then we have testing kits for COVID, testing kits for drug screening, pregnancy tests, INR tests, people on Coumadin. So there's a lot of equipment here. We have strep tests. So this is the kitchen area. This allows us, it's difficult for us to leave the office during the day to eat. So we can store our food in the refrigerator. We have a microwave. We have a coffee maker because we drink a lot of coffee during the day. And also we have a lot of cleaning products, trash bags. We have some stuff also from the pharmacy we've got stored here that doesn't have to be kept in the pharmacy. It's bags to bag up medication.
Yes. Yep.
And
Yeah.
also these cups.
Show that. Just show that. It's cleaning supplies.
Yep. So children's medication, we have to use, we can't use the tap water. So we have a cooler, we use water out of that for children's medication. We have cups here so that we can measure out the amount of water that's needed in the meds. We got a medicine cup, which is also a measurer. Cleaning products, toolbox, extra ice packs that we can freeze. We have a lot of samples that go over that have to be, have ice in the containers. Over here, Owen, we have a lot more cleaning products, and we have disposable washcloths. And we have a lot of stuff that's duplicated this upstairs in a big bedroom that we use to store supplies in, because we just don't have the room down here. We overflow. The other room we have is the pediatric room. We think of the pediatric room, we can use it for adults, but it's set up for peds because it has the baby scale over here. And we have in the ceiling things to keep the little kiddos occupied if they're looking up. Trees, sky, elephant with a mouse under the elephant's foot. And we have special equipment in here for peds, but we also have special equipment in here to do ear irrigations. And let's see what else. Other thing. So for gynecological exams, we have extra equipment for that. Also, Owen does the firemen's, the respirator, the exams for use of respirators, oxygen. We also have, these are the boxes of paper for the table, disposable paper. They take up a lot of room. This big cover here is just a big trash can, because we do have a lot of trash in this room. The baby scales, we have, there is a place underneath for storage, which we have full of supplies. We have a scale in each room. We have oxygen in here for emergencies. We also have the otoscope, the ophthalmoscope, and more equipment such as blood pressure, cuff, and thermometer, which we have in each room. We have gloves. Every room has their gloves, all different sizes for us, and also the automatic dispenser for paper towels. And then up here on the shelf, we have a lot of equipment we use, which is your Q-tips, your time depressors, your gauze pads, bandages, alcohol wipes, betadine. And there's more.
Okay. As you, I mean, pretty much what I see when I'm looking through the screen is that we are pretty well packed in and we're utilizing all of our space. Anyway, you can make your own judgments about that, but we don't have any more space to really expand this clinic as it is now. This is our charting. We're constantly revising this as the best way, but this is what we've come to over. It's a continually evolving filing system, how we do our files. This is one office. There are only two offices in the clinic. You've seen Linda and my office, and this is Dory's office back here, which is essentially the same size, but and that's sometimes before COVID, this was also a counseling office as well. Dory would pack her stuff up and put it in boxes for counseling sessions that would happen for an hour or so. And so that's a little something to know about. More storage that we have, we pile things in as it moves through. This stuff is always, it's constantly moving and changing. It's what it's doing. So.
I hope I'm not making you dizzy by running up and down the walls with the stuff.
Okay, right this way, we'll move through pretty quick. So you can get to your meeting. This is the office manager's area. This is Rhonda's section here. We have oftentimes in the summer, there's two people making phone calls out of this space, which is not great, but we'll have another phone put over there. So we've got two folks working out of here. Rhonda can get billing and administrative done while somebody else does the telephone calls. over here.
Let me just finish getting this.
Okay, and this is our file. This is our file room. This room we have expanded. We took, as everyone knows, or most everyone probably, we were able to take the men's bathroom and push this wall out so that we've had more file room as our files are expanding.
Let me show where these files go here. Go ahead. This is the work table that's used by Brandy and Cindy. The charts putting.
Two phones in here as well, pushed together. So
this is all of Peggy's binders for all the legal aspects of the office. And as you can see, there's a lot of charts. There's a lot of charts up in storage, up in the attic too. These are all active charts, except for the bottom row.
all right, come on out.
Hey, Owen, there's one question on the chat, and the question is whether you use any electronic records. So I'll throw that out to you. It came in on the chat.
Hi, so we are, most of our records are not electronic. The infrastructure isn't available to us to do that. But we are able to use read-only Epic through Penn Bay and Maine Health. But we don't use that in an active way. It's more of a passive. And we also use electronic health records for the opiate, the PMP, which is the physician's medication. It's a database that we use before we can write certain prescriptions. So we use it for that. Okay.
Am I whipping this around too much, you
This
guys?
is,
No, okay.
This is a waiting room. So our waiting room, pre-COVID, as you know, when you come, you would sit here with 5 or 10 other people or however many were in at the time. Odessa has taken a very active and robust role here with COVID, and this is now her office. We try to seat people in the cars. Occasionally we'll bring people in, at least pre-Omicron. The Omicron has changed a little bit, but the waiting room, we've just pushed the clinic out, and so now it's an office space instead of a waiting room area. We'll take you to the back. This is we've taken space in the hallway. You can see we store our stethoscopes essentially, and other things, having blood pressure cups right there.
Yep.
This is storage area back here, more storage, tape, alcohol, just all sorts of storage for our supplies.
Everything has to be cleaned. That's why the blood pressure cuffs are hanging there. When they're wet, we hang them along this railing to dry.
This is more COVID right here, more COVID things. Masks, not all COVID though. We also have cleaning supplies here, as well as a treatment table. The bathroom, this is the clinic bathroom, and washer dryer is in here as well as more supplies.
Can you, I just want to get that. It's pretty crowded here.
Yep. So
Washers, dryers stacked, hamper, more supplies in this cupboard for cleaning.
all right, we'll go to the treatment room. This is a treatment room.
Mention
No,
that.
You got that right.
No, I didn't.
This is where supplies that await sterilization right out here in the hallway.
To go into the autoclave.
Yep.
And batteries for the pappers, charging.
So this is our treatment room. Also functions as an exam room, as many of you have been in here. In this room, we have our autoclave. We have cleaning supplies for our instruments. We have all of this stuff, by the way, should be in a lab area as well. Same as with our lab. It shouldn't really be a kitchen. When we are audited, which we have some pretty thorough audits at times, they come out. They don't go as far as to give us an unfunded mandate and say we can't do that, but it's very irregular. Medicare's not going to come out and tell us you can't do that because we would have shut down. But it is an interesting conundrum, and most of the time they let it slide. But having this in an exam room is not how it should be. All of this is storage. It's just stuff. We got stuff, and that we use all of it. We use it, and it's just it's jammed in because that's what we have to do.
I'd just like to mention the sink. This sink we need because the big basins we use to wash wounds, and we need the sink to wash those basins in. Also, if you have somebody that has a traumatic injury like an arm or something, flesh hanging off, it's a good place to let them hang the arm or leg over the sink, and you can irrigate the wound.
Yeah, but it's also used for all sorts of other things. There's so many. Everything here is dual purpose, and we've got. This is a very well equipped room, and we are very grateful for it. It is packed in though. It's all just jammed in here for many purposes. Oxygen tanks over there. Ideally, the oxygen tanks wouldn't be in here. We would just have a spout coming through. You can see here, the oxygen tanks used to be in the meat locker. And then when Mert moved in there, we moved them back. This was a nice little window that we would open. And when we've had to move the tanks in here, and which is another, I don't know if it's a hazard, but you can see how basically I put some screws in the wall, or Mark, Craig, and I would put screws in the wall, and so that somebody couldn't come over and pull these over. A lot of things like that are kind of rigged up here to do that. Storage on the wall. These are fairly new in the past 10 years, but pretty. John Pardee made these. Did a lot of the woodwork around here. That if it looks nice, John Pardee probably did it. By the way, hats off to him. I think that's about it for the tour, as far as I can tell. But thank you for bearing with us. I know it was a lot of detail.
Mention the back door for ambulance.
Oh, yeah, sure. This is the when we have a patient in here, we take them out. We take them out the back to our ambulance bay, which doesn't our new this is interesting thing. So it didn't really matter when we put this in. We ended up putting a ramp in instead, so we wheeled them down the ramp to put in. Ideally, with an ambulance, you're going to back them right up to here and roll them right in, but there were gaps and it was unsafe, and our EMTs were at high risk of injury, so we had to change it around a little bit. But
so this is the COVID trailer. If you treat them, we're not doing a quick test. This is the treatment trailer, and we keep them out of the and then we have UVC lights that we can just put in the trailer after the visit that will sterilize the inside of the trailer.
I think we're done. Yeah, thank you all very much.
Thank you.